Many organizations have put up campaigns that seek to encourage the general public to get vaccinated against COVID-19 amidst concerns over low uptake of the vaccine in most parts of the country. Mr. Abdullah Guko is the country's director of Christian Aid, an international NGO working towards poverty eradication, and he shares with us how much the organization has done in terms of COVID-19 vaccine sensitization and the country's state of the Ebola pandemic preparedness along the Kenya-Uganda border.
Campaign, just sensitizing different community members to really come out and be vaccinated and ensuring that we're not able to, especially during this time when Ebola just broke out in America. Due to the limited funding, we're only able to scope a limited number of counties. So we're targeting Kisumu because it's nearing the border of Kenya and Uganda. We're looking at Nairobi and the fact that it's mostly cosmopolitan and there are lots of informal settlements there, and also targeting Mombasa because it shares a border with Tanzania to do. And the report from the AG is really timely because based on the research that we are currently conducting, looking at the hesitancy, why is it that individuals are really hesitant? There are lots of myths around there, but one of the key concerns that we had was, one of the key findings was with regards to the report of the Auditor General, showcasing that about 66% of the amount of funding that we got went towards the Secretariat of the COVID-19, and then more than about 52% of the amount of funding we received with regards to mitigation of COVID-19 was a loan. And these are money that we are supposed to be paying. So when such kind of reports come from the AG's office, it really casts aspersion on whether we really utilized our funding well. And who is going to bear all this cost is us, the Kenyans, because we are already being heavily taxed. And this has a net impact, especially if already the marginalized communities cannot afford a meal a day. Will they be going for a vaccine or even managing to buy maybe masks or sanitizers?
Speaking during a stakeholders engagement meeting in Kisumu, the chairperson of the Kenya Medical Practitioners and Dentists Union in the Nyanza region, Dr. Ndonga Onyango, says there is a large inequality when it comes to provision of health, and the public health stakeholders be interrogated to find out how much they are prepared to tackle health-related pandemics.
The report by the Auditor General, we really have to interrogate, public health in terms of preparedness, pandemic preparedness, and there are lessons we should draw from COVID-19. And these 4 major lessons we can get from COVID-19.
He further states that health can be used as a bioweapon, a security concern that the government should take as a priority during budgeting and finance allocation.
Health can be used as a weapon. It can be used as a bioweapon, and as a matter of security, all governments should make sure that health is a priority in its budgeting and in the way it is being handled. The second lesson that we get from COVID-19 is that there is large inequality when it comes to provision of health. And this basically means that when we have issues of pandemics, for example, SARS, COVID-19, and now we have issues with Ebola, most countries that are in the low-income setup tend to suffer more. And those countries that can actually, come up with resources to build, hospitals, vaccines are at an advantage. The other lesson that we come up with from COVID-19 is that we need to engage in a lot of public, education when it comes to health. Clearly, you can see from the report, now when I come to the report of the Auditor General, we find that a lot of vaccines were acquired for the people to use, but because of various reasons, they were either not used, they expired while in storage, and they did not get to the intended persons. And this really narrows down to, again, public health. How do we take our public health? Who is responsible for public education? Who is responsible for health education in the masses?
Speaking at the same event, Mr. George Collins urges the public on the importance of COVID-19 vaccination, and on the other hand blaming the government for the public's laxity on vaccine uptake, citing corruption as one of the major setbacks.
It is important for citizens to appreciate that indeed it is important to have the vaccine. And one of the things that the team has been doing is community organizing and working with different stakeholders in ensuring that we sensitize the public on why this is key. But the issues that are emerging in these processes, I think there's been laxity of the government officials also to take data. For instance, in my case, I took the 2 jabs. I'm yet to print my certificate. What that simply means is somebody neglected their duty in terms of keying in my details, and that is a big challenge. Secondly, there is the aspect of the society, the cultural and traditional beliefs. It is high time our leadership or any other person is in a point where they can make decisions to come up together with us so that then we can sensitize the public and tell them why COVID is there and why the issue concerning vaccination is also very key. Now, the other issue which is also very important in this process, and this will make the seriousness where it becomes, and I'm saying this in responding to what Mutai Kamwe was saying, in terms of saying that there are no doses that are lost. But it's not telling the public that the doses which you're claiming to have been lost are actually here. What that simply means is that there is laxity of the government officials who come out clearly to really talk openly in terms of what this is happening. That in itself makes the public to not take anything seriously. Because then, if you cannot account for the doses, then it means probably those doses are not even there, and they don't see why they should also come from vaccine.